Having a furry friend at home is a wonderful experience, but sometimes living together becomes unbearable due to allergies caused by their fur. Allergies can lead to watery eyes, colds, and itching. So, is it really necessary to get rid of our beloved pets? Dr. Rosalba Marino, an allergist, helps us navigate these challenging situations and find a solution that works for everyone.
Good morning, good evening to everyone. I am an allergist, immunoallergologist. My name is Rosalba Marino, and I have been working in the field of allergies for about forever, my whole life. Because I saw my first allergy in 72, I was 14 years old, fifth grade. So I handle all the various pathologies that involve the immune system and that cause specifically allergies. We refer to them as allergic diseases or allergopathies. Essentially, allergies can impact the respiratory system, affecting the upper airways, causing allergic rhinitis, and the lower airways, leading to allergic bronchial asthma. They can also affect the eyes, causing conjunctivitis, the skin, resulting in dermatitis, and the intestines, leading to forms of food allergies. Thus, I have always been known for treating allergic conditions in a certain way holistic, thus considering everything that constitutes a patient who therefore is not alone, let's say, an organic pathology, but who might also have repercussions, might also have mental health issues. So, in this context, allergopathies have been characterized in recent years by having an increasing number of patients who also experience a realm, let's say, of psychological discomfort. I wonder who today does not have some form of psychological discomfort. Raise your hand. We are survivors of an unexpected pandemic that was unforeseen for ordinary people. Immunologists, in reality, have always had pandemics well within their repertoire, and now with a war, price hikes, and so on. Allergic patients are individuals who frequently have to bear the full cost of their treatments because there is an insufficient number of allergology services available in the public healthcare sector. Additionally, almost all the medical devices and supplies that are used are not covered by insurance. Consequently, an allergic patient is someone who understands that in order to maintain their well being, they must incur expenses. Therefore, I almost always conduct a brief health education session on the condition, which involves enlightening the patient about the strategies they should adopt. This is because saving money today often leads to higher expenses in the future. In essence, if we administer an effective treatment, whether it is option A, pharmacological therapy, or option B, immunotherapy, we have essentially made a valuable investment in the patient's health.
Let's talk about animal related allergies. Are there allergies that are strictly related to animals?
Naturally, we have various allergies like allergies to dogs, cats, horses, hamsters, rabbits, etc., which are common and important. It poses a genuine question since animals can also experience allergies. Allergies can range from allergies to animals such as dogs, cats, horses, hamsters, and rabbits to allergies relating to epithelia, dandruff, and more.
Is it possible to treat these allergies?
The issue at hand is whether the individual is positive for a specific allergen from cats, dogs, horses, hamsters, rabbits, and so forth. We must then determine the extent to which this positivity is linked to the clinical picture. For instance, if we examine 1,000 teachers who have been working in schools for at least 30 years, we will observe a high percentage of teachers allergic to cats, even if they do not own a cat. Why does this happen? Because we do develop allergies to the things we breathe in, and often in educational institutions, there are cat allergens carried on the jackets and sweaters of students who own cats. Therefore, in such situations, we might not have sensitization that is detected during tests, and the patient does not exhibit symptoms when they are in direct contact with animals. However, I always emphasize that maintaining an unclean underbrush, which means keeping an unclean respiratory system with these subliminal allergies, certainly does not contribute positively to one's health. So we have multiple possibilities to consider. Firstly, there is the possibility of being sensitive to the cat and dog test without displaying any specific symptoms. Secondly, there is the possibility of testing positive for both cat and dog allergies and subsequently experiencing symptoms affecting various parts of the body, such as the eyes, nose, throat, bronchi, and skin. As mentioned earlier in the introduction, sensitization to these allergens leads to the manifestation of different types of symptoms, with respiratory issues being the most common. Allergic rhinitis, characterized by symptoms such as a runny nose and sneezing, is often observed in individuals with sensitivity to cats.
What are the most common symptoms you might experience? Are there any animals that cause them more frequently?
Yes, frequently cat and dog, more frequently rhinitis symptoms. So, symptoms affecting the nose, such as itching, sneezing, runny nose, and nasal congestion upon contact with the animal. It is obvious that if the person does not have the animal at home and is clinically allergic, they will have symptoms in the presence of a cat. If the person has the animal at home and is clinically sensitive and tests positive, the symptoms can be perennial. So when the allergist takes the patient's medical history, which is their clinical history, one of the first questions they always ask is if there are animals at home. This is because the first thing to consider when dealing with a perennial allergy is whether the patient is allergic to animals. However, it should be noted that in the past 20 years, pets have become so well loved by their owners that in most cases, even with very high skin and blood tests, we rarely see severe syndromes such as asthma. It's almost as if having a cat or other pet provides a protective effect. The companionship and affection they offer have been found to increase the release of endorphins, which in turn helps to reduce allergy symptoms. I always advise patients to thoroughly assess if there may be other allergenic factors before jumping to the conclusion of eliminating the animal responsible for their allergies. It's not always a straightforward case. For instance, if I run a basic allergy test and detect a reaction to cats, I might assume it's solely because of the furry feline. However, if I delve deeper into the patient's medical history, I might discover that the real culprit is a specific type of mite called Domesticus glyciferus, which thrives in Venice. Considering the patient works in a dusty office in Venice, it's possible that the allergy stems from exposure to this mite. Thus, it's essential to make a proper diagnosis before immediately instructing the patient to get rid of the animal implicated in their allergies, as they may be able to coexist by keeping the animal outside in their garden, even though cats have a natural inclination to enter the living space. So the final action I take would be to eliminate the cat or any pet from the house, especially if a child is involved.
How can I manage to live with a pet and an allergy to it?
I conduct a therapy, I try to understand the pathology well, then I intervene in the pathogenetic dynamics, I make a correct diagnosis, I frame the patient well, and then we decide what to do. Anyway, in any case, we have specific therapies, which are the vaccines for cats. For for dogs, it's a bit more difficult, but for cats, for example, I've vaccinated many people for cats. They are fine, they get used to the animal, the symptoms gradually disappear, so why not? Cat vaccine is a vaccine given.
Are cases of animal-related allergies increasing nowadays?
Allergies have witnessed a significant surge in the past decade, and this includes animal allergies as well. Just like other allergies, the prevalence of nut allergies in certain regions, such as Veneto, was practically non existent in the past. However, these areas are now grappling with a considerable influx of hazelnut allergies. On that note, if one were to take a leisurely stroll through the fields in some villages, what would they observe? I can only see hazel trees everywhere as they produce the precious hazelnuts. These delicious nuts are a key ingredient in the wonderful chocolate we enjoy. It's evident that certain aspects, such as a genuine urbanization policy, have never been considered or implemented. Interestingly, our faculty in Padua has specific branches dedicated to aerobiology. However, despite this focus, we have never actually implemented a policy. So, if we insist on planting trees, let us be patient and considerate. Unfortunately, the birch tree, known for being an aggressive allergen, is made even smaller and more harmful to our lungs due to air pollution. Therefore, it's best to avoid planting birches. Let's not forget that. Take a walk in the parks, and you will surely come across birch trees. So, prevention can be achieved now to the extent that we make an effort to plant trees that have a low impact on allergies. It's not for me to say, but for the urban planners to decide.
Can allergies be detected for the increasing number of unconventional animals that are becoming more common nowadays?
But let's say I don't deal with unconventional animals except for those like the rat, which is very trendy now, the guinea pig. However, I know of allergies that develop when feeding animals to certain snakes, for example. Over time, if you always feed rabbits to snakes, you can become allergic to rabbit fur because you touch them, you handle them, and unfortunately, this is the reality. There are animals. Do we have a detailed census of boa constrictors in Italy? I believe there are some. What do they consume for food? Who feeds him? So these are extreme cases, but they can exist. Then allergies to snakes I do not treat. I have never treated, so I wouldn't know from this particular perspective.